Today the topic of our discussion is cardiorenal syndrome. First of all, we will see what is cardiorenal syndrome. This is cardiorenal syndrome. So it has two portions. One is cardio, other is renal. So what is cardio? Mean related to heart, and renal mean related to kidneys. So it is actually a type of syndrome in which there is condition leading to pre-renal failure. Pre-renal failure. So I have written pre. So how it leads to pre-renal failure? The important concern for today is how it leads to pre-renal failure. So when there is a condition that is congestive heart failure, so it can be left heart failure or the right heart failure. This left heart failure or right heart failure. If there is left heart failure, then it will lead to decreased stroke volume or decreased cardiac output. The left heart failure can be due to multiple reasons. It can be due to the prolonged hypertension, but the main concern is what it leads to. It actually leads to decreased stroke volume and decreased cardiac output. So when there is decreased cardiac output, that ultimately leads to decreased renal perfusion. Here you can see that. So when there is decreased renal perfusion, it ultimately leads to pre-renal failure. So if we see on the other hand, when there is right heart failure, there is actually a back pressure that causes the increase in central venous pressure. And when there is increased central venous pressure, that ultimately leads to decreased glomerular capillary pressure gradient. Now what is this? In simple words, we have to find that what is actually decreased glomerular capillary pressure gradient. So if we see that if there is increased central venous pressure, what it will lead to? That it will lead to increased renal vein pressure. So when there is increased renal venous pressure, that actually causes decreased glomerular capillary pressure gradient. So here we see that this is the renal artery. This renal artery forms multiple veins, and that ultimately leads to the renal vein. This is renal vein, this is renal artery. So when this pressure increases, so the gradient that actually leads to the filtration that is in the glomerulus. So first of all, we will see what is the glomerulus. See this. Actually, there are multiple renal arteries that divides and redivides from arcuate artery, interlobar artery, and ultimately leads to the interlobular arteries. So the interlobular arteries first form afferent arteriole, and on the other hand form efferent arterioles. You have to know that in glomerulus, both of the arterioles are actually the part of the arteries. So the filtration is actually going through the arterioles. So this renal artery leads to this, and that ultimately leads to the perivascular capillaries, and that ultimately leads to the renal vein. So when there is increased renal venous pressure, that actually causes backflow of pressure here. When there is backflow of pressure here, there is increased afferent arteriolar pressure. When there is increased efferent arteriolar pressure, that will actually causes decrease GFR and also decrease this, the glomerular capillary pressure gradient, because this is actually increased and this is where will be decreased. So that ultimately leads to the decreased glomerular capillary pressure gradient. So one thing here and one thing here, these both lead to the increased glomerular filtration, decreased glomerular filtration rate. When there is decreased glomerular filtration rate, that is causing the renal injury, because the supply, actually the venous supply that is taking the blood out of the kidneys, is actually hindrance, causing hindrance. So that leads to the renal injury. To accommodate that, there is activation of renin-angiotensin aldosterone system that actually causes the sodium and water retention and sympathetic stimulation. So all that ultimately leads to again the cardiac failure. This. So actually cardiorenal syndrome is actually one condition causing the worsening of the other condition. When there is cardiac failure, that ultimately leading to the renal failure. So two things that is actually causing the main condition is increased sodium, because in this condition there is actually not complete renal failure, it is actually the pre-renal failure. When there is pre-renal failure, there is increased sodium absorption, and there is increased sodium absorption, there is actually decreased sodium in the urine. So we can differentiate with the other form of pre-renal, renal and post-renal failure by checking the urinary sodium concentration. So in this there is increased reabsorption of the sodium, and with the reabsorption of the sodium there is actually increased water reabsorption, and with water reabsorption there is actually increased blood urea nitrogen reabsorption. So when there is increased blood urea nitrogen reabsorption, so there is increased sodium levels in the body, there is decreased FeNA, that is functional excretion of sodium, we also called it at FeNA, and there is increased blood urea nitrogen. There is also some ratio, we call it as blood urea nitrogen ratio to correct, that is usually 20:1. So that also helps to differentiate the pre-renal failure from the other causes of renal failure. So thank you so much for today. We will again come with another video. Thank you.